So this is a paper about summary of COVID-19 dataset, and we gather different, there are different datasets available in the market by government and other organizations. So we just prepare the summary of it that is useful for research or other, maybe apply some data mining techniques on it. So my name is Syed Raza Bashir, and Shaina Raza is the second author. She is my wife also, Vidhi Thakkar. She is also working with my wife and in an organization. They are both doing postdoc. And Usman Naseem is also doing PhD, and he is in Sydney, Australia. So this is, we collaborated with Usman and Vidhi and me and myself to look into this because we are doing the research on data sets, and especially about COVID-19, different techniques. We have other papers also on COVID-19, find out the, you can say, the how to track and how to find the patients and other things. So with working on that to find out these, so we come up with to create our own data set for that. So this is that's why we put this paper up. So as you can see here, so this is the main data set that are developed by COVID-19 research. And there are different, and this data set is not only that we applied also for other papers, but it is also helpful for computing community, biomedical experts, and policymakers in pursuit of effective COVID-19 treatments and management policies. And like different major organizations like WHO, John Hopkins, and National Institute of Health, they also have their own data sets that are available. But so these data sets basically originate from a variety of different sources and initiatives. So we will discuss numerous sources that introduce to support text mining applications throughout the COVID-19 literature. And we discuss corpora, modeling resources, systems, and shared tasks introduced for COVID-19. So this is our basically introduction, COVID-19. It's a SARS, severe acute respiratory syndrome, coronavirus, 2 related to acute respiratory infection diseases. And that was discovered in late 2019, and it was declared by a pandemic, global pandemic by WHO in March 2020. And we all affected by this, and many people lose jobs, and over 500,000 deaths, 400 people jobs due to this COVID-19 pandemic. And still there are still, like in Canada also, that there are rising cases still now, but because of these, you can say the vaccine, the severity is very low. So still people are suffering. Still there are deaths with coronavirus, and so the long COVID-19 effects also being studied in this in the latest research. To summarize about information about the epidemic, that it defined a generation is becoming nearly overwhelming. So a few projects such as CoronaNet, COD-19, and United States county level data set, among a few that presents a collection of data from different sources. So these are the major, you can say, data sets that are available. But these, however, these nature of these data sets are different. For example, this CoronaNet and county level data sets are repositories of government responses, while the COD-19 too is a collection of academic literature. So one is from the government responses and other one is from academic literature. So our approach is unique, that because we consider focus on multiple data resources and data types, such as like epidemiology, literature, government policies, labs data, mortality, and other miscellaneous data. So we believe that our summary of COVID-19 data set is basically a first step in a very efficient and a research landscape for understanding the COVID-19 data sets for pandemic and its effects. So just one second. So this is to deal with this overwhelming amount of COVID-19 literature. So we come up with to create a very comprehensive data set. And there are like 8, we find out there are 8 different types as per the type of research being conducted. So we have a survey data. So the data that we conducted from survey. So this is the data that is in this table number 1, that we it's basically from Statistics Canada, that Canadian Prospective Survey Series. And then we move down here, food insecurity, different from different sources, that is Statistics Canada. So we get that one, number 1. Number 2 is Canadian COVID-19 Antibody and Health Survey, CCAH, again Statistics Canada. Then Pulse Survey on COVID-19, SPEC and Statistics Canada employees. This is another data set that we look into that one. Uniform Crime Reporting Agency Select Policy. So this is number 1 data set is from the survey data. So these are in table number 1, all the survey data that we find out and put it are in data set. This is number 1. Number 2, so there are total in 8. So second one is about the epidemiology data. So this is the basically what is epidemiology is the study of how often diseases occur in different groups of people and why they occur. So this is a very a new field, and this is also epidemiologists and different departments like University of Toronto also have that department now, and they have a special degree in that one. So this is epidemiology data, second one. So these are the data sets that we gathered from epidemiology data. And then we have COVID-19 data set by source, like directly from different clinics, like here from this data set is from Mayo Clinic, Center for Disease Control and Prevention, New York Times, John Hopkins, COVID Active 19. So this is from data set by source. So this is the third category. Fourth one is from projections data. So this is a models worked with a big data set. So this is for projections data. This is the detailed summary for this lab data. So there are different also different labs that conduct. So like here we gathered it from, this is the table, University of Washington's Medicine, Department of Laboratory Medicine, eHealth Ontario, Public Health Ontario, British Columbia Center for Disease Control. So this is the fifth one. Then we also consider mobility data that can also be used to determine the extent. So this is mobility data from Google, Institute for Disease Modeling, from Meta also. Then the death rate mortality data, we also gathered that, seventh one. So this is from Flourish and Worldometers, so we gathered that. And the last one is public and mental health data set. So we also gathered that one from there. So these are all the tables, and it's a very extensive study to gather it and put that one all together. Then we also have text mining data sets and tools. So we have text mining data sets and text mining tools. So what is text mining? Also known as text data mining, or sometimes we also call them text analysis. And is method for extracting valuable information from the text. So so we do text mine. This is text mining data set. COVID-19 open research data set is the starting one, earliest and largest literature corpora to create COVID-19 text mining. And there are details about that one here, and different papers that we include is all mentioned here. And this is, we summarize that one in this text mining data table. WHO data is here, CDC, elsewhere publisher, Spring Nature publisher. Then we also have text mining system for literature have been released. So these are different text mining tools, COVIDX, KD COVID, Azure Cognet Search. So these are different KATTH also from multiple sources. So this is our basically the main purpose is to have the data set that is combined from different sources, and all, not only from government but also from the clinics, different other departments, so that it becomes a so that we can different departments like epidemiologists and other computer scientists also use this data to do their research, or like I told you that we also write other papers based on this data set. So just for the conclusion is that COVID-19 emergency research governments have made numerous databases publicly available to allow research groups. And these data spread are dispersed across a wide variety of initiatives and sources. And the main purpose of this article is to compile a list of all the world's major open data sets. And our goal is to provide a roadmap of establishing links between various scientific fields like health sciences, epidemiology, artificial intelligence, and mental health. And we also provide this most up-to-date information for wide range of COVID-19 data set. And these are very critical for information. And also, we also include a list of most commonly used COVID-19 data set and tools. And it may not include many other COVID-19 data. However, because I mainly curated the most important up-to-date COVID-19 data sources, and we believe this is the list is representative for other COVID-19 data sets as well. So this is this is a part of CIHR Health System Impact Fellowship. So this is basically part of this, and this is we put the acknowledgement for CIHR, and these are the different references. And if you have any questions, please let me know.